Hello and welcome to another episode of Local Expert Interviews. My name's Michael Grady, and today we're going to be speaking to Dr. William Hart of Hart Cosmetic and Reconstructive Surgery in St. Louis. As a triple board certified plastic surgeon, Dr. Hart holds board certifications in plastic surgery, facial plastic surgery, ear, nose, and throat, and microvascular and hand surgery. Dr. Hart offers a variety of cosmetic procedures ranging from breast augmentations, tummy tucks, rhinoplasty, and facelifts. Welcome, Dr. Hart.
Thank you, Mike. Good to be here.
Dr. Hart, please tell our viewers a little bit about yourself and your practice in St. Louis.
Well, I have been in St. Louis for approximately 35 years. I went to undergraduate school here at St. Louis University and then did my medical education at St. Louis University as well. After that, I did part of my training here at St. Louis and then did my plastic surgery training at University of Texas at San Antonio and a hand and microvascular surgery fellowship in Wayne State University in Detroit, Michigan. I've been in practice for about 20 to 25 years. Most of my practice is focused on cosmetic surgery.
Dr. Hart, today we'd like to ask you some questions about rhinoplasty.
Sounds good.
So maybe you could share with our viewers, who is a good candidate for rhinoplasty?
Well, someone that's a good candidate is somebody that has a deformity of their nose, whether it be developmental, meaning an excessively large dorsal hump, over-projecting nose, or it's something that's traumatic from an accident or an injury where the nose is deviated, there's some asymmetries, but something that's noticeably out of line with what's felt to be the normal parameters of someone's nose.
Other than cosmetic surgery on the nose, do you also work with people that have breathing problems through their nose?
Yes, I do. If it involves work on the septum or the internal lining of the nose, the turbinates, then I will do that at the time we're doing any cosmetic work, yes.
Well, if somebody wanted to have some work on the nose, whether for cosmetic purposes or for breathing problems, in your opinion, how should someone select a surgeon to perform the surgery?
Well, I think this is something that a patient needs to do very carefully because not all plastic surgeons do nasal surgery, and it's good to find somebody who has a special interest in this area, maybe has had additional training and experience in doing nasal surgeries, because rhinoplasty requires a very fine, almost artistic eye, and very small errors in contour or shape can be noticeable follow-up. So you should check your surgeon's credentials, you should check his experience, and you should also make sure that he has a lot of photographs that he can show you of patients with different types of nasal problems and how he approached them.
Well, let's talk about some of the risks and complications that accompany rhinoplasty. Can you kind of talk to our viewers a little bit about that?
Well, some of the complications and risks are the same as for any surgical procedure. Bleeding, a nosebleed afterwards. This is very uncommon. I believe I've had one patient who had a nosebleed after rhinoplasty that required any treatment at all. The other complications, infection, is even less common. We give a dose of intravenous antibiotics beforehand. We place patients on antibiotics for about a week afterwards. And nose has an excellent blood supply, and usually we do quite well as far as any problems with wound healing or infection. Other problems that you can get into are contour abnormalities, where sutures shift, where bone shifts or gets out of alignment. You can have regrowth of bone over the dorsum when you take off a hump. These things, if they occur, are usually something that can be corrected in the office under a local anesthetic. So these are some of your more common problems that you see after nasal surgery.
So let's talk about after a patient comes in and has had the rhinoplasty, what's the post-operative course following the rhinoplasty, and what's the general recovery time?
Well, after rhinoplasty, we normally do not use packing on procedures that involve the external appearance of the nose. unless we have to take some cartilage from the septum. In those cases where the septal cartilage needs to be realigned, or we need to use some of the septal cartilage to help achieve the contour we're looking for in the nose, then sometimes we'll use packing. If we do use packing, it'll stay in about 3 days. We also have an external splint on the nose, and that stays on for usually about a week. After that, we'd like a patient to take it easy for a total of approximately 3 weeks as far as exercise or any potential contact type activities are best avoided for about 3 or 4 weeks.
Now, I understand that there's a couple of different techniques when it comes to rhinoplastic surgery. So what are the difference between open and closed techniques of rhinoplasty?
Well, an open rhinoplasty is one where you make an incision across the base of the columella, right in here. It's usually a stair-step incision, and then the remainder of the incisions are on the inside of the nose. What that does is it gives you access so you can look at the cartilages under direct vision, and you can get them aligned very perfectly, especially if you're doing some detailed work on the tip of the nose. I think that this offers an advantage. If generally you're just removing a dorsal hump, then an intranasal approach where the incisions are all on the inside of the nose works very well.
Why is secondary rhinoplasty a more difficult procedure?
Well, secondary rhinoplasty, oftentimes you don't have the records from the prior surgical procedures, and there may be more than one surgical procedure. The other difficulty is that there is going to be scar tissue, and this is in a relatively thin plane where you're dealing with the mucous membrane on the inside, then you have some small amounts of loose areolar tissue, then you have the cartilage, and then beyond that you have a very thin layer of subcutaneous tissue, and then you have the skin. So if you substitute in there a layer of scar that's involved with any remodeling that's done to the cartilage, then it can be a difficult task to achieve the contour and shape in that type of a situation.
Now, I think I heard you say, Dr. Hart, that sometimes there's a requirement to have more than one surgery to fix an anomaly?
Well, that's a rare case, and mainly those are situations where tissue is missing from a traumatic type injury. In those situations, we may need to move or shift tissue around to provide a lining on the inside of the nose, and then use tissue to cover the outside of the nose. Those are the kind of cases where you would have more than one stage. Using a straightforward cosmetic rhinoplasty, usually the results can be achieved in one operative procedure.
Well, if a touch-up is called for or even necessary, how long should someone wait before doing a touch-up after rhinoplasty?
Well, I really try to wait no less than about 4 months. In some cases, it's preferable to wait as long as a year before doing any type of revision, because you're allowing for the scar tissue to fully mature, and you have less reaction, and you can get a better result.
Dr. Hart, you have given our viewers a lot of great information about rhinoplasty. Is there anything else you'd like to tell our viewers?
Well, again, it's similar with any cosmetic procedure. Always do your homework. It's not bad in some situations to get a second opinion, and make sure you're comfortable with the surgeon you're going to make that decision to work on your problem with.
Dr. Hart, fantastic information. I'd like to thank you so much for sharing with our viewers.
Well, thank you, Mike. It's been a pleasure.
Again, my name is Michael Grady. This has been another episode of Local Expert Interviews. We've been speaking to Dr. William Hart of the Hart Cosmetic and Reconstructive Surgery in St. Louis. If any of our viewers would like to get more information about rhinoplasty from Dr. Hart, please refer to the phone number at the end of this interview. Again, Dr. Hart, thank you so much.
Thank you very much, Mike.